Did you know that 42,000 Americans die each year of opioid overdose? That averages to 115 Americans each day. Opioid abuse has become a huge issue in the United States. According to www.drugabuse.org, it states, this issue has become a public health epidemic with devastating consequences, including not just in opioid use disorders and related fatalities from overdose, but also the rising incidence of newborns who experience neonatal abstinence syndrome because their mothers use these substances during pregnancy. Today, we will look into the crisis of opioid abuse for pregnant mothers, discover some possible recovery methods, and then explain the benefits from this solution. Sadly, opioid use in pregnancy has escalated dramatically in the recent years. www.acog.org states, in 2007, 22.8% of women who were enrolled in Medicaid programs in the 46 states filled an opioid prescription during pregnancy. An increase in neonatal absences has rose from 1.5 cases per 1,000 hospital births to 6.0 cases per every 1,000 hospital births. Babies with neonatal absence syndrome are at a greater risk of seizures, respiratory problems, feeding difficulties, low birth rate, and even death. Opioid use is a major problem, and more women need to be aware of the consequences that opioid abuse can cause. There are many recovery options for women who are pregnant and that are abusing opioids. The options are, but are not limited to, behavioral counseling, medication, follow-ups, and medical devices used to treat withdrawal. According to www.drugabuse.gov, it states, a range of care with a tailored treatment program and follow-up options can be crucial to success. Treatment should include both medical and mental health services as needed. Follow-up care may include community or family-based recovery support systems. Withdrawal and relapse are very common when trying to come off opioids. So it is highly recommended that medical and mental help be taken when pregnant. There are so many benefits of living a happy, healthy, clean life away from opioid abuse. The biggest benefit as a pregnant woman is having a healthy pregnancy, which increases the chances of having a healthy baby. In the event that recovery doesn't happen until or during or post-pregnancy, that the woman still has a chance to be a mother to the child, rather than the state taking away the child. Today, we have looked at the crisis of opioid abuse for pregnant mothers, discovered some possible recovery methods, and then explained the benefits from this solution. Opioid abuse has become a huge issue in the United States. Opioid abuse in pregnant women can cause neonatal abstinence syndrome in newborns. For the protection of women and unborn children, it's time to take a stand against opioid abuse.